Capitol Report is a production of Senate Media Services.
On this week's program, the first of a two-part series, we'll begin to take a look at how the aging of the baby boom generation and the increasing diversity among the younger population is changing the face of Minnesota. Stay tuned for this week's Capitol Report. Welcome to this week's program. I'm Shannon Loehrke. We're at the beginning of an historic shift in Minnesota, and we begin with state demographer Susan Brower to examine demographics and statistical data relating to populations and the shifting makeup of Minnesota. The baby boomers, those born between the years 1946 to 1964, continue to be an extraordinary force shaping American culture and policy. The oldest members of the baby boom cohort began reaching retirement age in 2011, and the group's shift out of the workforce is one significant change affecting the future of Minnesota.
The change that we are anticipating is one that is unprecedented in our state's history. The growth of the baby boomers will go from about 600,000 in 2010 to about 1.2 million in 2030, so it's really compressed into those years, and it will cause a number of shifts and pressures on a number of different kinds of policies and programs and perhaps budget pressures, and it will also impact labor force growth as the baby boomers move out of the workforce.
Minnesota has a strong tradition of providing a high quality of life for its citizens, and its two largest budget expenditures fall in the categories of education and health and human services. Understanding how the changing demographics will impact the state's budget is imperative.
You know, if we look out another decade or two, that's when the baby boomers will be moving into the older ages, and then we'll begin to think about health care and long-term care and those kinds of things. Right now, when we look at the way that we fund long-term care, so that's part of medical assistance or MA here in Minnesota, these are the services that people use that aren't covered by health insurance. They're usually related to activities of daily living and less kind of medical expenses. Oftentimes those are paid out of public funds after either because people don't have the money to pay for them themselves, or because they have to spend down so that they become eligible.
The shift to an older population will significantly impact Minnesota's economy. One area of concern is whether there will be enough qualified workers to fill the positions vacated by the baby boom generation.
The size and the growth of the labor force is something that we're watching very carefully, because it's kind of the other side of this aging trend. We do project that the labor force will continue to grow. When you look at everyone ages 16 plus, will still continue to grow into the future. The growth will just be very, very slow. So we're getting to a pretty critical point where we're close to full employment in a lot of places across the state right now, and we still anticipate a number of retirements coming up with not a lot of people kind of filling the place of those retiring.
And this concern for sufficient qualified workers for a healthy economy dovetails with recent findings concerning racial and economic equity in Minnesota. In January, the Minnesota State Demographic Center issued a report on the economic status of Minnesotans.
One of the things that I wanted to convey in that report, and also in other work that we do, is that the growth in Minnesota is largely coming from populations of color. That happens through births, and that also happens through migration. And so I want people to understand that our younger generation are more racially, ethnically, and culturally diverse than the folks who are leaving the workforce, the older Minnesotans that we have. So looking specifically at, say, Somali Minnesotans or Hmong Minnesotans, you're able to get a better sense of how that community is doing. And we saw that many populations of color that have been in the U.S. for many generations are really not faring well on a number of different kinds of indicators, such as income, labor force participation.
To further illustrate the impact of these demographic changes, the Demographer's report notes that by 2020, more than 1/3 of workers aged 20 to 64 will be persons of color in the 7-county Twin Cities metro area. But significant change is also happening in rural Minnesota, and the nature of the changes and the challenges faced vary by region.
Many of our rural communities are already experiencing kind of the pressures from aging right now. They don't need to wait another 10 or 15 years because they've experienced the loss of the younger generation, many communities, because of migration to metropolitan areas. They're feeling it in terms of finding the workforce that they need to staff their care facilities. We hear from around the state that that's happening already.
Both rural and urban aging populations have specialized needs for transportation, and whether it's senior citizens or the population in general, the types of transportation and the funding mechanisms for transportation have become divisive political issues.
The aging trend in general is going to kind of bring all those issues to the fore. In rural areas where you don't have that density, it's going to be really tricky to be able to find a way to transport individuals, and I think that's going to be one of the major programmatic or policy issues facing rural areas in the state and facing greater Minnesota.
Aging populations have increased needs for health care and services, and with the sheer size of the baby boom generation now moving into the older age group, state government services and budgets may become strained. Joining me now to talk about those changes is Minnesota's Commissioner of the Department of Human Services, Emily Johnson-Piper. Welcome, Commissioner.
Thank you for having me.
The state demographer spoke of the sheer size of the generation, and Minnesota has the second longest longevity in the nation. Is there a silver tsunami coming?
Well, I think the answer is yes. And I think, though, that it's not unexpected that we have been preparing for this for a long time as a state and continue to today to try and make sure that we're evolving in the way we're doing business as a state, providing services to people, anticipating that we're going to have this silver tsunami coming.
The CDC in 2013 said that 2 out of 3 older Americans will experience or do experience chronic health conditions. How can the state pay for what's coming?
Well, that's a really big challenge because we pay a little over $1 billion every year already in Medicaid funding. So just on the public health care program side for long-term care, we project by 2040 it'll be about $4 billion just based on what we know about our population. And so what we have to continue to ask ourselves is, how are we going to do things differently? How are we going to change the way we're serving people to make sure that they have that adequate support necessary, but also that they have choices and they have quality of life they want going forward as well.
One program I read about on your website was Own Your Future. Can you talk a little bit about that?
Own Your Future is a really cool campaign that we've been advancing as a state, and it really is about making sure that people are prepared for retirement and that they're planning for their future. And it started out as a public awareness campaign. A few years ago we surveyed about 10,000 people and identified that 1/3 of them didn't have any plan for long-term care. And so we have since then been really working as a state trying to develop real changes to long-term care and services, and including right now Own Your Future working on development of long-term care insurance policies for the state of Minnesota. One is a term to long-term care insurance, and then another one is a potential rider of long-term care on a supplemental Medicare supplemental policies to try and make sure more people are prepared.
So these are products that individuals can purchase to kind of help be more prepared?
These would be products that we're trying to work through so that they're available to people going forward. Yeah, that they then could purchase, hopefully, so that they have long-term care coverage moving forward as they age.
Now, anecdotally, I've heard a lot of boomers talk about how they don't want to end up in a home. How can people stay in their homes, in their communities longer, and have good quality of life?
Well, it's interesting because Minnesota has an interesting history in this way. In the 80s, we were the state with the highest number of people living in nursing homes, and we put a moratorium on nursing home beds. Okay. And since then, we've really shifted into focusing on how can we help people age in place? How can we help them stay in their homes? And we have lots of programs that we try and work with individuals, including providing them services that they need to stay in their homes, and then when they enter into a nursing home, making sure that while they're still, before they spend down their assets, because it's really expensive to live in a nursing home, we focus on those people and try and get them to return to community. And so we have programs in place to help build the supports in community for seniors, to make sure that if they don't want to stay in a nursing home, that there are adequate and available services in the community to help them stay in their homes as long as we can let them.
So I'm a child of baby boomers, but I haven't had that conversation yet with my parents about, you know, their aging and what they hope for and if they're planning. And what advice do you have for children of baby boomers to kind of have this conversation with their parents? And also, what advice would you have for boomers who didn't have children or aren't sure where they might get the help that they need as they age?
Well, I think, you know, one of the real challenges, and I have that same issue too with boomer parents, and what we know about the demographics of how many people are aging and what that silver tsunami looks like, you and I are going to be the caregiver team in part for our parents. And so we do need to start those conversations early and often, make sure that they have financial plans, that while they still have capacity, that they have advanced medical directives, that we know on the front end what they want to do, where do they want to live, how do they want to age, and having those conversations as a family, I think, is key before the changes are needed to be made to help support a person. And we also have really great resources for seniors in Minnesota. We have a senior linkage line, 333-2433, that people can contact and get all the information that they need.
So this is a statewide
senior linkage line with all sorts of resources and really great professionals ready and willing to help people.
From your point of view, though, you are encouraging people to really start looking at this now and be planning for their own futures. Is that correct?
I do, and I think we're already feeling and facing the real challenges we have as our population ages. We have workforce shortages in our long-term care, direct care treatment sector, and so we're already feeling the pressures of the age wave coming.
Commissioner Piper, thank you so much for joining me today.
Thank you.
Minnesota has been one of the whitest states in the country, 4.4 million of its 5.2 million residents. But that is rapidly changing due to increasing diversity among the younger generation. In fact, 87% of the population growth last year came from people who are African American, Asian, American Indian, or Hispanic. Joining me in the studio is co-chair of the Subcommittee on Equity, Senator Jeff Hayden of Minneapolis. Welcome, Senator.
Thank you. Thank you for having me.
Our state's future growth will be fueled by people of color, and yet those populations historically experience lower outcomes in education, healthcare, and income. What policies might be able to address some of these discrepancies? Well,
I think that we have been studying that for a while, and I'm really glad to say this year we took a forward step with this Committee on Equity. We were able to secure over $70 million, $35 million up front, $17 million every year thereafter, to really target this issue of income inequality in these communities that have to deal with anything from education, job training, as well as entrepreneurship and some other support mechanisms that help that. I also serve on the Health and Human Service Committees, and we're doing an awful lot of work on healthcare disparities, ensuring that people have access to healthcare, that they're compliant, and that we're looking at the social determinants of health, which also really, I think we're thinking about in terms of wellness, the communities that they live in. And in education, I don't serve on the Education Committee, but there has been a lot of talk on what do we need to do from early childhood education to making sure that kids are ready for kindergarten, and then giving them the supports that they need, and then ensuring that they have a great post-secondary opportunity, via that be college, vocational schools, or even just certificate job training. So I think the legislature has been focused on that issue, and its commitment to that has really been demonstrated on creating the subcommittee on equity.
So the governor had originally asked for $100 million, and all parties agreed on $35 million. Where does that money go?
Yeah, and I guess I would say that $35 million up front, but $17 million thereafter.
Right.
So we think that
ongoing.
it's about $70 million, which could continue in the out biennium. Okay. So we think we're a little closer to the $100 million, especially if you take the money that was put in education and a couple of other places, agriculture. So we think we're very close to the $100 million. Okay. The money that we are really most focused on is really job training, is really entrepreneurship opportunities. We always hear that small business is the backbone, right, of our economy in the United States. Well, we believe that people of color, especially the immigrant populations, have a great opportunity to create small businesses in their community. Though we're losing population in outstate Minnesota, but where we're gaining is in the immigrant community. So we have also focused on the opportunity to have those job training opportunities when people are leaving. One of the former demographers said that Minnesota is getting browner and grayer, right? And so the opportunities to really get those folks to kind of come in and backfill for the opportunities and the jobs that they had before, as well as create entrepreneur and small business all throughout the state. We think it's a great opportunity. And so the legislature has been laser-like focused on targeting those that haven't been doing well. And we know that through a lot of the data and the documentation, we know who those folks are. So we're really, really focused on creating opportunities, along with the private sector, the philanthropic community, and local government, to really leverage all of those opportunities to really uplift this population, which is good for Minnesota.
So can you just be a little bit more specific about who gets the money?
Yeah, well, we were able to secure, I think, about 11 direct appropriations to organizations, for instance, like the Neighborhood Development Center, which really trains entrepreneurs. MEDA, which takes entrepreneurs that already have small businesses and helps them grow. Organizations like the YWCA in Minneapolis, that's helping to train people to become early childhood development specialists, or the YWCA in St. Paul, which is really focused on giving people a commercial driver's license, which means that they could go work for Metro Transit, they could be over-the-road truck drivers, they could become mechanics. Places like Twin Cities Rise that has a partnership with Metro Transit, so people could become, for instance, technicians on the light rail line, or they could be operators. So there, and I shouldn't have named names because there's a bunch of folks that we're doing. We also have a competitive bidding process that allows organizations that didn't get a direct appropriation to work with DEED and to come up with proposals that we have vetted, that we think are going to help folks, and we to then move forward. And the last thing is we have a capacity building. So for people in organizations that have great ideas and just need us to help them flesh that out, we have some capacity building money for them as well.
So one of the statistics that's been in the news lately is that there have currently been 5 workers for every 1 elderly person. And we're very quickly approaching 4 workers per elderly person. And so when you consider that there's going to be fewer workers and more elderly people, there's some concerns for enough tax revenue, especially considering people of color have traditionally made lower incomes. What are your thoughts on that?
Well, I think number one, we have to acknowledge that there is some implicit bias that happens in the hiring process. there is some implicit bias that happens in terms of what people are paid. I think women have shown that. We've done the Women's Economic Security Act that really showed that women didn't make the same amount as their male counterparts. I think the same statistics would be true of people of color. So we do have to look inwardly and think about who we're hiring, for what job, and what are we paying. And that really starts to deal with the income inequality. We also have to think about our elderly population as someone that can contribute. So my mother, my mother-in-law, and others have now retired, but they're thinking about it, and they're working kind of smaller part-time jobs or opportunities. So I think that we shouldn't think about elderly folks as this group that then is just going to go offline and then never work again. I think that there's unique opportunities for them to work in the way that they want, be mentors, help the younger workers who are coming through to kind of develop the skill sets that they need. And we know that technology will help us, that maybe we don't need as many workers, but we will use technology that will be smarter. But there will be some work that just needs to be done in the same way. And so I think that when we look at our trends and our population trends, I don't want to turn this into an immigration conversation, but that's why it's important, because we are going to continue to need those workers, the ones that are here today, and then certify those that are here that are working and get them on some path that they can become citizens or at least have the opportunity to work. And I think once we add those to the population, to the working population, that then I think we'll be okay. But we do have to address this issue of inherent biases in our system that often we as Minnesotans just really don't like to do.
Very, very true words. Thank you, Senator Hayden. That's all the time we have today, but thank you for coming.
I appreciate it. Thank you for having me.
Rural areas of the state have unique challenges when it comes to aging baby boomers and changing demographics. And joining me in the studio to talk about his rural Minnesota Senate district is Senator Bill Weber of Luverne. Thanks for joining me today, Senator.
Well, thank you for having me. It's a pleasure to be here.
The state demographer, Susan Brower, has said that some rural areas are already experiencing the aging baby boomers and the effects of that, and also a tight labor market because of the exodus of some of the younger generations to metro areas. Are you finding this to be true in your district?
Well, yes. The short answer is yes. I think to expand upon that a little bit, it is a trend that we have seen going on for far too many years. Unfortunately, one of our best exports from the rural areas has been our young people. And partly we're to blame for that from the standpoint that we have had an exodus of a lot of our rural manufacturing businesses across the state line. For example, years ago in Luverne, we had Luverne Fire Apparatus, Luverne Truck Equipment. They were both homegrown businesses, and due to the business conditions, they moved across the state line. And they left Luverne with probably a combined workforce of 70, 80 people, and they grew to 250. But that growth happened across the state line. Now, they were close enough that some of the people were able to, they continued to live in Luverne because that was home and commuted to work. But in other instances, businesses have went too far, and that has not been possible. You know, and we see it just in the general population shifts. When I was first involved in Republican politics, that was in 1976. I went to my first precinct caucus. Our Senate district at that time was 4 counties in the southwest corner of Minnesota. Today, my Senate district is all or parts of 9 counties. I have 6 whole counties and parts of 3 other counties that comprise my Senate district. So we just see that in the ever-expanding size of our districts in the rural areas, and probably the shrinking of size here in the metro area.
So there's also the increased diversity that's happening. I know Worthington has been profiled several times because of the influx of immigrants, particularly Latin American immigrants and Lao immigrants for meat processing plants and things like that. Nobles County from 2000 to 2010 saw the greatest increase in the immigrant population. How's that playing out? Because I know, Nobles County is separate from the other areas of your district, but are you seeing immigration in other areas also, and is that a possible solution?
Well, I think that you do see it in other areas. For example, Marshall sits 4 miles outside of my district, and so you do see in terms of they have turkey processing, other food processing plants there, and so you see that same type of thing happening in that scenario. And I think that it does, in those particular communities, it does increase the number of younger people as children, come with their families into the area. Obviously, it creates some additional dynamics for your school districts because they're having to deal with a large enrollment in terms of trying to teach them English to begin with, sure. and then also a lot of times these younger people are sort of serving then as sort of the liaison between the parents and the community because mm-hmm. they can understand and speak English, and mm-hmm. the parents have not learned that. So, but it also creates an unusual dynamic in the Worthington School District, for example. I don't know the exact number again, but it's well over 30 different languages are spoken there, and so it becomes a real a real challenge.
Yeah.
Yes.
Can we talk about doctor and dental care briefly? There was an article recently in the Star Tribune that said that in the metro area there's 1 doctor per 300, and in certain rural districts it's 1 doctor per 2,000. Is your district experiencing a lack of healthcare workers like some areas already are, and it's projected to increase?
We have. In my particular district, my hometown of Luverne, of course, is 30 miles from Sioux Falls, South Dakota, which has large
big
healthcare facilities there. They have actually, over the years, Luverne, when I was a councilman and mayor, we had a city-owned hospital, had forever. I was on the hospital board for 8 years. During my term as mayor, the hospital was sold to Sioux Valley, now called Sanford. Mm-hmm. You have Sioux Valley, Vera McKinnon, that have a lot of different associations in our communities. And so, yes, having adequate healthcare personnel is always an issue, but because of the affiliations that have been made with these larger facilities, typically there is an avenue for service to be provided. Not always is every service available within someone's hometown, mm-hmm. but within a reasonable travel distance, those type of services are.
So this brings up the concern of transportation. As these baby boomers age and maybe can't drive or need help, what are your thoughts on how those people might be able to get to their doctor appointments or get their daily needs, grocery shopping, et cetera?
Well, we do have a system in place, that is able to provide transportation services. We have an extensive volunteer system for a lot of our retired people that are willing to go out and drive these individuals. But within the transportation system, we do have, Heartland services, a lot of different these bus services that are able to take people. Mm-hmm. Probably from a medical standpoint, one of the greatest challenges that we have is that the Medicaid-funded transportation is so messed up mm-hmm. that many of our medical transportation service providers want nothing to do with Medicaid patients mm-hmm. because they aren't being paid nearly enough, or what we're seeing is that a lot of our institutions, whether it's our nursing homes or hospitals, quite frankly, are eating some of this cost sure. just because the state program is totally messed up at this point.
So I know healthcare is going to come up again in the future, but that's all the time we have for today. I hope to have you back. Thank you for joining me.
Thank you very much. It's been a pleasure being here.
Tune in again next week for part 2 of our focus on the changing demographics in the state, where we'll concentrate on education. From all of us at Senate Media Services, thanks for watching.